want to contribute to the nursing in US in a way I can share my knowledge, my experience. So I am excited because I like it when things are done based on evidence. So I really appreciate that. So I'm excited to learn and then render it to the patients and the facility that I'm working for.
As an Avant Clinical Operations Manager, our role is to support the nurses on assignment and help them be successful. So we help guide them through their orientation and also are their clinical point of contact throughout the duration of their assignment. We provide clinical support via education shared via a professional development plan. We also do one-on-one individualized virtual sessions with the Avant nurses to be able to support them with effective communication strategies, patient experience initiatives, and also with clinical scenarios to help build critical thinking skills. We also have scheduled calls with their unit managers, and we build strong relationships with the facility leaders and are able to leverage those clinical partnerships to be able to advocate for the nurses, problem solve, and also to have a solutions-focused strategy when challenges arise. It's also a great way to be able to find out about the wins the nurses have on their units, like if they get nominated for a DAISY or win a DAISY award.
I was working in an emergency department, and this particular couple, the husband was sick and wife was unable to walk. She was not very mobile, so the husband was terminally ill. So he came to the emergency department and they were not affording anything. So since he was terminally ill, we gave him whatever treatment at that time, and we had to discharge the patient. They did not have money to even go back home, and they had to stay up whole night. And I joined for the night duty, and I saw them because they had visited there already a couple of times before, so I knew them. Since they did not have money and they were waiting for the next day morning to go by a public bus, I felt bad because they did not have even food at that time. I contacted the public relation officer of a hospital, and we together arranged for a vehicle for them, and we also arranged for food. That was a time of need, and when you help a person in time of need, not just with medications and the hospital care that you provide, but also as a whole for the patient, it does make a difference. So I feel proud for that.
There's times when you have deep conversations with your patients and their words of wisdom you remember. So it's kind of, in these moments of joy and happiness and everything else in between, that's where the nurses live and breathe with their patients. And so I know I've made a difference because it's been my mission and my drive. Telling myself every single day that if you can make a difference, however small, in someone's life, then whatever hardships you're going through, it's worth it. And that still rings true today, working with Avant nurses with the opportunity to be able to change lives.